Hello, my name is Anaya Webb, and this is my week 7 return to demonstration video over trach suctioning and trach care. For this video, I do not have a patient. I'll just be explaining the steps and the procedure that is done for this particular skill. Of course, I will start off with AIDED by introducing myself to the patient and letting the patient know that I will be their student nurse for the day and that I will be completing trach suctioning and trach care. Then I'll be doing a proper cleaning of their trach, and it should take no more than 5 to 10 minutes. And I will thank them ahead of time for cooperating as I am completing this assessment and this skill. So I would verify 2 patient identifiers by checking my patient's name and their date of birth. I can have them verbalize that to me and check it on their bracelet and match it up with the information that is in the computer to make sure that I have the correct patient. I will verify the physician orders of doing the trach suctioning and the trach care. I will provide privacy by pulling the curtain or shutting the door. And of course, I will explain the procedure to the patient and the rationale of why I am suctioning and cleaning their trach. And I will answer any questions that the patient has. And I will also obtain verbal consent. I will raise the bed up to my hip level so that I'm able to do the assessment at a correct angle. I will make sure to place the patient at a semi-filers or filer position. I will also take the lungs. I don't have my stethoscope right now, but I will also take the lungs with the diaphragm side of the stethoscope. Actually, let me grab that. Okay, so yes, I will use my stethoscope. And I will use the diaphragm side of my stethoscope to also take for the lung sounds in the certain areas of the lobes. After I also take my patient's lung sounds, I will turn up the supplemental oxygen, and I would do that per my policy's protocol for the hyperoxygenation protocol. I will perform hand hygiene. I will don my PPE such as a face mask and goggles, and then I will go ahead and get my supplies set up. So to start off, I will start off with suctioning the trach. So I have my suctioning catheter, I have my container for my sterile water, and I have my sterile gloves. So I will go ahead and I have this open. So I will go ahead and open up the, So I'll go ahead and open up the container that will have the sterile water in it. Looks like this part came off. So I will make sure that this plastic is inside. So this keeps the sterile water in, which will be my saline. So this is where my saline goes in. So I'll make sure this is open. I'm gonna go ahead and pretend like I'm pouring some saline in there. So I have my saline. So then I have my sterile gloves. I will go ahead and put those on. I will go ahead and open these up. So when putting on, you only want to touch the bottom part of the sterile glove. So I'll go ahead and put the first one on. Uh-oh, sorry, I'm having just a little trouble here. So I'll only open it from that. And then I will slide my hand in the second one. Like this. I'll make sure just to pull down. Alright, so I have my kit open. I have my sterile water in the container. And then I will go ahead and take, all of this will be on a sterile. So I go ahead and take my tubing. So we have this catheter part. Well, this is the catheter part. This will be hooked up to the suctioning. So I'll go ahead and curl this part around in my dominant hand so it's not in the way. So with my non-dominant hand, I will go ahead and turn on the suctioning canister, and I will regulate it to 100 to 200 with my non-dominant hand. And then I'll go ahead and get that set up. And also with the non-dominant hand, I will make sure to take, this is the part that will be connected to the suctioning. So I'll have that, and I'll go ahead and connect it to the suctioning in the wall. And then I'll go ahead and uncoil this with my dominant hand, and I want to make sure that I dip this into the sterile water. So this is already, we're going to pretend like this is into the suction. I'll dip the end of the coil, end of the catheter into my sterile water so that it's being flushed out and cleaned. And then with my dominant hand, so this is in the wall already. We're just going to act like this is in the wall. I'm just going to sit down. So with my dominant hand, I'll go ahead and take the mask off my person's trach. And I will remove that over their trach. And then I'll go ahead and so I'm taking off the mask, and then with my dominant hand, I'll go ahead and insert this catheter into my person's trach. So I'm going to go ahead and insert it in, and I'm going to push it in until I feel resistance or until my patient coughs. So once I have done that, go ahead and I'll go ahead and, so this is hooked up to suctioning, and still with my I'm sorry, not with my dominant hand, I will insert this. With my dominant hand, I will insert the catheter, not with my non-dominant hand. So I'm inserting this until resistance or until the patient coughs. And then I'll take my non-dominant hand, this is hooked into suctioning, and I will place my thumb over this part. And I will just make the suctioning by just pushing my thumb over at a fast pace to make that suctioning kind of movement. And as this part is in my patient's catheter, in the trach, I will pull back and just turn a little bit as I'm pulling back. And then I'm also pressing this side for suctioning. So as I'm suctioning, I'm pulling back slowly and turning also in that movement. And then I will make sure to do this no longer than 10 to 15 seconds. So once I've done that, I will go ahead and take this again and stick it into the saline to rinse and clean. And I will complete that step for a second time. So I'll do that step for 2 suction passes. After I have completed that, I will move on to disconnecting the suctioning from the catheter. So I'll go ahead and disconnect this from the suctioning out of the wall, and I will discard that into the appropriate bin, such as the trash can. I still have on my sterile gloves because I'm going to, after I discard the catheter tube, I'm going to check the trach. I'm going to check the trach for coca. So I'm going to remove the stoma, which is kind of like a gauze padding that is placed under the patient's trach. So I'm going to remove that, and I'm going to check for coca around my patient's trach. So I'm looking for color, odor, I'm looking for consistency, and any amount of anything that's coming out, like any type of drainage. So I'm looking for the consistency of the drainage, the amount of the drainage. So after I have assessed for coca, I will go ahead and remove all the suction equipment. I'll take the suctioning off the wall. I will go ahead and remove my gloves. I'm going to go ahead and remove those. and I will put all that into the trash, and then I'll perform hand hygiene because now I'm going to move on to cleaning the trach. So I have removed all of this and discarded. So now we have the for trach care. So I have my trach care kit. So I'm gonna go ahead and open this kit. At the bedside table, I have a towel or a dressing for everything to be placed, not in a contaminated area. So then I will go ahead and I'll open this. So I have my sterile gloves that are in this kit also. So I'll go ahead and put one pair on my dominant hand. And then I have in the kit, so I still have my sterile water that I have. I'll take the gauze pad. This is what I'll be replacing a new one over, placing a new gauze over the stoma. Well, replacing a new stoma dressing over the trach. So I'll go ahead and kind of dip this and get it a little moist in the saline. So I'm dipping this into my fake saline water and just kind of getting a little moist. And I'll go ahead and kind of just like sit that down. But I'll make sure to be on a uncontaminated area. It'll still be in a sterile field. So after I have done that, my patient will have a inner cannula that is in the trach. So that'll already be removed. And I'll be, before I do that, I'll make sure I go ahead and put my other glove on my non-dominant hand after I have. So with the non-dominant hand that doesn't have a glove, I'll make sure to pour the sterile water into that container, and then I will moisten the gauze. Then the old inner cannula will be removed, and I'll go ahead and insert the new cannula, and I will make sure that it's in a locked and secure position, and you kind of twist it in a little bit gently and make sure it's in a locked and secure position. And then I have so then after that, I will take these cotton moist tips, and these are basically be applicators to clean, like gently clean the inside of the outer side of the outer cannula, and kind of clean inside the trach and clean around the stoma before I apply it, and make sure that I'm getting all the bacteria and all that out of there. And then after that I have done that, I will make sure to stabilize the trachea with my non-dominant hand, and that is when I'm going to place the dressing. The dressing that will be under, this dressing will be placed under that in your cannula. This is the dressing that I will place. So I'll get that nice under there. And then to keep it in position, I have these zip ties that will be placed on the sides of the trach. So basically I'll place one in at a time. So I'll place one on the right side, and the old ties will still be in to keep it in place while I'll be putting in the new ties. And I'll make sure to securely fasten them, and just basically kind to using a square knot to get those in place so that the trachea is in a stabilized position. And after I have placed the new ties on both sides of the trach, I will go ahead and discard all of my equipment. So I will take off my gloves, and I will basically throw everything in the trash, clean up my area, and I will make sure to put the bed back in the lowest position and lock the bed, and I will raise up the rails. I will make sure that my patient's call light is within reach, and I will perform hand hygiene. After that, I will document. I will make sure that I have the right patient's chart that I'm documenting on, stating that I have performed trach suctioning and trach care. I will make sure to note the type and the size of the inner cannula that was placed within my patient's trach. And I will make sure to note that what type of method that I use, a sterile or clean method. As you see, I use a sterile method for suctioning and trach care. After that, I will obtain vital signs, and I will also take my patient's lung sounds. I will also take lung sounds before trach suctioning, and after suctioning. I will make sure that I document the amount of oxygenation that my patient is on. I will document all the procedures I will perform, such as changing the stoma and applying a new dressing and cleaning with the cotton tips and new ties. I will also document if there were any type of secretions that were coming out of my patient's trachea. I will make sure to document coca, the color, odor, consistency, and the amounts. And I will also make sure to document my patient's tolerance to me suctioning and cleaning their trach, if they were having any pain, any resistance, if they were fine with it, and just a calm manner. And I will also make sure that I signature and initial my documents, and that will be all. Thank you.